My name is Professor Bob Mash, and I am the president of the South African Academy of Family Physicians, the professional body for family doctors in South Africa. Vaccine hesitancy for coronavirus vaccination in South Africa has been fueled by conspiracy theories and misinformation. Unfortunately, some of this misinformation has come from health professionals, most notable recent example being Dr. Susan Vosloo, a cardiothoracic surgeon in Cape Town. However, family physicians have also been seen to promote unproven treatments such as ivermectin and even nebulized colloidal silver. Our approach to coronavirus infection should be led by science and an evidence-based approach as the science evolves. Vaccines have been shown to prevent hospitalization, severe disease, and death from COVID-19. In the UK, shown in this picture, the high levels of vaccination led to a dramatic reduction in deaths between the second and the third waves of COVID-19. In the second wave, the number of average daily cases reached 33 per 100,000 population. And in the third wave, with the more infectious Delta variant, 34 per 100,000. So very similar numbers of cases between the second and the third wave. However, in the second wave, average daily deaths reached 36 per 10 million. And in the third wave, only 2 per 10 million. It is clear, therefore, that while vaccines do not fully prevent transmission, they do save lives. 4 different types of vaccine have been developed based on messenger RNA, viral vectors, viral proteins, and inactivated virus. In South Africa, the AstraZeneca vaccine was effective against the initial strains of COVID-19 in the first wave, but not to the Beta variant, which drove the second wave of infection in South Africa. This is why the vaccine was not implemented in South Africa. Healthcare workers have been vaccinated with the Johnson & Johnson vaccine that is effective against initial strains and the Beta variant, although more data on the Delta variant is still awaited. The Pfizer-BioNTech vaccine has been shown effective against the initial strains, the Beta variant, and the Delta variant. The Johnson & Johnson vaccine is given as 1 dose, while Pfizer requires 2 doses, and the full effect is only seen after the second dose. Vaccines may cause minor side effects in the first 24 to 48 hours after injection. Side effects such as pain and redness at the injection site, headaches, mild fever, chills, or muscle pains. More severe allergic reactions can occur, but are extremely rare. The South African Health Products Regulatory Authority has investigated all deaths that occurred after vaccination and has not yet found any evidence to link them to the vaccination. In South Africa, vaccination is also recommended in pregnant women after the first trimester. Getting vaccinated is the best approach to protecting ourselves against hospitalization and death from COVID-19. It will also help to reduce symptoms, transmission, and the viral load in those infected. Although death from COVID-19 is more likely in certain groups, such as the elderly or those with diabetes and hypertension, no age group is entirely risk-free. The South African Academy, therefore, urges all South Africans to vaccinate to protect themselves and those around them. As of the end of August, we have vaccinated almost 12 million people in South Africa, a remarkable achievement in a very short period of time. We need to increase our rate of vaccination even more to try and protect our population ahead of a possible 4th wave in the summer period. Africa, unfortunately, is the continent with the least vaccine coverage, and many low and middle income countries have struggled to secure a supply, while many high income countries have bought up more than their fair share. Canada, for example, bought 10 doses for every citizen, and Australia and the UK, 5 doses for every citizen. We must also fight against such inequity in access to the vaccines and ensure that our government has secured sufficient supplies. In closing, therefore, I urge all eligible South Africans to get vaccinated. I also urge our membership of the Academy to speak out publicly and encourage your communities to vaccinate, to challenge misinformation and conspiracy theories, and to assist with vaccinating our population.